Hi, you guys. Welcome back for our daily practice questions. It's day 17, but first, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, Q banks, digital flashcards, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminders that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a 68-year-old female presents with blurred central vision and difficulty reading, especially in dim light. She also reports noticing straight lines appearing distorted. On exam with Amsler grid, the patient notes the lines appear wavy. Based on this clinical presentation, what is the most likely diagnosis? Is it A, diabetic retinopathy, B, macular degeneration, C, retinal vein occlusion, or D, glaucoma? Take a moment and tell me what you got in the comments, you guys. All right, y'all. So y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you, right? So here the stem of the question states, based on the clinical presentation, what is the most likely diagnosis? And y'all know, if they're looking for a diagnosis, I tell you, you got to run it back, right? And look and see what this assessment findings show us, right? We're looking to see how they present it. We're looking to see those signs and symptoms. What was the chief complaint? What was noted on exam? And y'all know I always say, when you're looking at those assessment findings, pay attention to three details if they are provided: the patient's age, their gender, and their ethnicity, as this can contribute to the diagnosis as well as treatment in most cases, okay? So here we have a 68-year-old female. She comes in complaining of blurred central vision and difficulty reading, especially in dim light. She's also noticing that straight lines appear distorted, and on exam, she has a positive Amsler grid report because the patient notes that the lines are appearing wavy, right? Y'all, this is classic presentation of B, macular degeneration. You know, with macular degeneration, when we're assessing those centralized vision changes, and they're doing the Amsler grid, if the lines appear wavy, that is an abnormal finding. She's already saying straight lines appear distorted to her. She's having blurred central vision. All of these are key descriptions for macular degeneration. So B is your best answer. Question number two. A 72-year-old male presents to the office for a routine visit. He is concerned about worsening vision loss. After further assessment, the nurse practitioner diagnoses the patient with macular degeneration. What is the most appropriate next step? Is it A, nothing at this time, B, refer to ophthalmology, C, photodynamic therapy, or D, laser surgery for the retinal damage? Take a moment and tell me what you think. All right, so stem of the question here states, what is the most appropriate next step? All right, so what are we even talking about? What's going on here? And when we see the next step, that's typically management, treatment, planning, right? So we need to know a diagnosis. No different than if I tell you about a treatment, I always tell you to see if they have provided you with a diagnosis. And if they have not, then you run it back all the way to the top. Run it all the way back and look at those assessment findings. But here, it's already told us that there are diagnosed with macular degeneration. This patient came in for a routine visit. They were concerned about worsening vision loss. There is a confirmed diagnosis of macular degeneration. So what do you do now as the nurse practitioner when this patient is in front of you? You're going to refer them out, right, to ophthalmology for further evaluation and management. All right. And last but not least, question number three. A 68-year-old female with a history of age-related macular degeneration presents with complaints of blurred central vision and distortion to her vision. You want to screen her for any new changes in her macular degeneration. Which of the following tests is commonly used to assess the changes in central vision, such as distortion or blind spots in patients with macular degeneration? Is it A, optical coherence tomography, B, a fluorescein dye test, C, Amsler grid, or D, the Snellen chart? Take a moment and tell me what you got, y'all. All right, all right, all right. So, stem of the question here states, which of the following tests is commonly used to assess for changes in central vision, such as distortion or blind spots in patients with macular degeneration? Now, here is a prime example of how the stem tells you everything that you need to know to answer this question, right? So, what test do we use most commonly to assess for central vision changes, such as distortion or blind spots in patients with macular degeneration? And C is your best answer. We use the Amsler grid. Now, optical coherence tomography is used to help and aid in the diagnosis of macular degeneration, but that's more on the ophthalmology level. Remember to stay in your scope. Do not let these questions push you into stuff that just because you're unsure that you're just picking things that we don't even do in practice, right? The fluorescein dye test, we utilize that for like herpes keratitis. Snellen chart, is for visual acuity. Amsler grid is specifically utilized for centralized vision changes and most commonly utilized with macular degeneration. So make sure you know these things so you're not missing those. And look at an image of that Amsler grid so you're familiar with it as well. So even if you are provided with that, you know what they're talking about. But again, the best answer is C. All right, you guys, as always, I hope you found this helpful. Please be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio1@gmail.com. Everything that I offer is linked in the bio of this channel, including my website. And if you're looking to book any of my one-on-one sessions, student tutoring, or any of my coaching custom packages and plans, I always say either call, text, or email so that I can speak with you first to gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Make sure y'all meet me back here. Happy studying. Bye, y'all.